The central nervous system. Central nervous system is composed of the brain and spinal cord. Here you can see cadaver images of the brain and the spinal cord. The central nervous system has many different protections. First, it is protected by bone. The brain itself is fully encased within the cranium, and the spinal cord is being protected by the vertebrae. There are tissue wrappings around the central nervous system, both the brain and the spinal cord. Those tissues are called meninges. The meninges are 3 layers of very tough connective tissue. The 3 layers are the dura mater, the arachnoid matter, and the pia mater. The functions of the central nervous system meninges are to cover the brain and spinal cord, and also to contain the cerebrospinal fluid. Meningitis is a disease which results in inflammation of the meninges. It could have a viral, bacterial, fungal, or even other cause to it. Viral meningitis is the most common. It's usually mild and can often clear on its own. Bacterial meningitis is usually much more serious, and without antibiotics, it can lead to permanent neural damage and even death. Fungal meningitis is pretty uncommon. It's not contagious and it develops relatively slowly. And then there are also other things that could cause meningitis: chemical reactions, drug allergies, cancer, and inflammatory diseases all could cause inflammation of the meninges. Symptoms of meningitis would be a headache, fever, stiff neck, vomiting, mental cloudiness. And risk factors would be skipping vaccinations, living in a community setting, which is why they really stress meningitis vaccinations for students going off to college. Pregnancy and a compromised immune system are also risk factors. So back to protection of the central nervous system. The cerebrospinal fluid is another protective mechanism. The functions are protection, as it cushions the brain to limit cranial injury. It creates buoyancy. It allows the brain to float, which prevents excess pressure at the base of the brain due to gravity. It basically reduces the net weight of the brain. And it also functions in chemical stability. It can carry toxins and other wastes away from the brain. The cerebrospinal fluid is produced within the ventricles. These are fluid-filled cavities that support the brain from the inside. We only have about 7 teaspoons of cerebrospinal fluid at any given time. It cycles and then is reabsorbed, and about a half liter of cerebrospinal fluid is produced daily. So here you can see where the ventricles are that are producing the cerebrospinal fluid, and then you can watch the video that shows how it actually flows around the brain and spinal cord. Hydrocephalus is when there's an imbalance between the amount of cerebrospinal fluid produced and the rate at which it is absorbed. So it's not absorbed as fast as it's produced, which causes a buildup of cerebrospinal fluid. The ventricles start to enlarge, and it puts pressure on the brain inside the cranium. There's different types of hydrocephalus. There's congenital hydrocephalus, which is present at birth. It's an interaction of genetic and environmental factors that occur during fetal development. And it's usually diagnosed before birth through an ultrasound. There's also acquired hydrocephalus, which develops after birth, and that's a result of some sort of neurological condition: head trauma, brain tumor, cyst, intraventricular hemorrhage, or infection, like meningitis could lead to hydrocephalus. It's often diagnosed by MRI or a CT scan. Often, hydrocephalus is managed with a VP shunt. It's a tube that's placed within the ventricular system of the brain, and it then diverts the cerebrospinal fluid to the abdominal cavity, where it then is reabsorbed by the body. Another traumatic brain injury is a concussion. This occurs when the brain slides back and forth against the inner walls of the skull. This is often caused by direct impact, an acceleration and quick deceleration, or a blast. The symptoms of a concussion are often temporary: headaches, vertigo, dizziness, problems with concentration and memory, lack of balance and coordination, drowsiness, confusion, nausea, and vomiting. Treatment for a concussion is relative rest. And so most of the time, it's some sort of mental rest where you want to limit the activities that require thinking and mental concentration. So limit video games, TV, schoolwork, reading, texting, using a computer. It's recommended for about the first 2 days after a concussion, and then you will try to gradually increase activities if it can be tolerated without triggering symptoms. It's going to depend on how severe the concussion was. Concussions also require physical rest, and that's to avoid physical activities that could increase symptoms. So that means you might need to avoid physical exertion, sports, or any vigorous movements. It has been shown that light exercise and physical activity a few days after injury actually speed recovery, but you want to avoid activities that have a high risk of another head impact, because the effects of concussions can be cumulative, especially if you haven't fully recovered from a previous one. Complete rest is not usually recommended, and complete rest would be a dark room avoiding all stimuli. And the reason that that's not recommended is because it does not seem to improve recovery time. Using the mental rest, physical rest, and then trying to get back as soon as possible without triggering symptoms seems to be the best course of action in terms of a concussion. There can be rehabilitation therapies like using vision, balance, and cognitive sorts of therapies, especially if thinking and memory seem to have been impacted. And previous concussions increase the risk of future concussions and can slower recovery time overall. Spina bifida is another birth defect, and this occurs when the spine and spinal cord don't form properly. There is a range of spina bifida. It can be very mild or it could be extremely severe. So, spina bifida occulta would be closed spina bifida. This is the mildest and most common kind of spina bifida. This means that there's a small separation or gap in one or more of the vertebrae. This oftentimes is only discovered because imaging is being done for some unrelated reason. Sometimes there might be hypertrichosis, which is abnormal hair growth on the lower back, and that might be a reason for someone to think that spina bifida could be an issue. Open spina bifida is the most severe type. And this is when the spinal canal is open along several vertebrae in the lower to middle back. And when this happens, the meninges and spinal nerves can push through the opening, and there's the possibility of forming a sac on the baby's back that exposes these tissues and nerves. This can have many more risk factors associated with it. There could be life-threatening infections because we actually have an opening, paralysis because those spinal nerves are being exposed, and bladder and bowel dysfunction. Spina bifida is thought to be the result of a combination of genetic, nutritional, and environmental factors. It appears to be more common among whites and Hispanics. Female infants seem to be affected more often than males. It seems to be correlated with folic acid deficiency of the mother during pregnancy, as well as there being a family history of neural tube defects. There's been links to certain medications during pregnancy that could lead to spina bifida, diabetes, obesity, increased body temperature due to fever or using a sauna, all could contribute to spina bifida. The severity is going to be affected by the size and location of the defect, whether the skin is covering the affected area or whether it's exposed, and which spinal nerves are being exposed. Some complications could be walking and mobility problems, orthopedic complications, bowel and bladder problems, as mentioned before, hydrocephalus, because it could interfere with the flow of the cerebrospinal fluid, seizures, meningitis, and a tethered spinal cord, where the spinal cord is actually connected to other tissues. The mild form of spina bifida, closed spina bifida, often doesn't require any treatment, and that's the one that could even go undiagnosed for a long period of time. Open spina bifida, there could be fetal surgery done prior to the 26th week of pregnancy. After the 26th week of pregnancy, then they're probably not going to do anything until after birth, in which they would do some surgery after birth. The baby would need to be born through cesarean so that it wouldn't cause any more damage to the spinal cord during the birthing process.